The key to this is that they should not feel the needle going in. They should feel a little something after. And that little something that you feel should be like a little bit of achiness, maybe a little bit of heaviness. Maybe you feel a little tingling, but nothing that's needly, nothing that's fiery or burning or anything like that. And I always like consult with my patients and say to them, hey, if you notice something like that, I need you to tell me. You don't have to endure anything here.
Many patients ask about the use of acupuncture and traditional Chinese medicine for fertility treatment, but does it work? Here to teach us about the Eastern medicine approach to fertility care with lifestyle modifications, herbs, acupuncture, and more is internationally recognized award-winning doctor of acupuncture, Dr. Lee Hullender Rubin. Lee, thank you so much for being here today and welcome to Baby or Bust.
I am so happy to be with you, Laura.
Can you tell us exactly what Eastern medicine is? Or when you say traditional Chinese medicine, I mean, it's more than acupuncture. Can you explain that?
You know, TCM has a broad toolbox, and I love having my toolbox because it shows that we're really adaptable to what patients need. And what can be in that toolbox to support fertility specifically is acupuncture. You could use laser acupuncture, which has no needles associated with it. Heat therapies like moxibustion or like a warming light. You could use electroacupuncture or one that you don't use needles for. It's called transcutaneous electroacupuncture stimulation. And that's like a TENS machine, but on acupuncture points. We also use other manual therapies like cupping, gua sha, which is having like this great moment on Instagram right now, Tui na, which is a medical massage. And then you've got your movement and your breathing exercises that are also part of Chinese medicine, which are Qigong and Tai Chi. And then we sort of round it out with nutrition, herbal medicine, and lifestyle modification.
It's a very different philosophy. In Western medicine, you're fixing what's broken. And in Eastern medicine, you are trying to prevent getting broken. So tell me if I'm wrong, but traditionally in Chinese culture, you actually pay your TCM provider for preventative care. And when you're sick, you actually don't pay them because you're paying them to help you not be sick.
Right.
Whereas in Western medicine, you kind of avoid going to the doctor as best you can because you only go if you are sick and you need a pill or your broken arm fixed.
Our primary goal is to prevent disease, but once you do become sick, that then we can shift our focus, much like Western medicine is reactive and can really address things as they're happening. We will do the same. And of course, there's going to be places where we have limitations, and then there's going to be places where we really shine.
And so how would traditional Chinese medicine or TCM approach fertility care and treatment?
When we're thinking about Chinese medicine as an explanatory model for, what's disease, what is wellness, what's fertility versus infertility, we take that to help design our treatment. So we'll be putting people into quote patterns, much like you do when you're looking at patients, you're looking at them individually. We are doing the same thing. And we're again coming back to that adaptability, thinking about the whole person, trying to make sure that we're addressing all of the aspects that could be contributing to infertility. So, not just are you ovulating, but hey, how's your digestion? Do you poop regularly? Like that's important to us. How are you sleeping? Sleep is very well documented as being associated with having regular ovulation.
What could someone expect if they went to see a traditional Chinese medicine provider at that first visit? And kind of what treatments do you think would be offered in certain fertility situations?
Yeah, I think, again, coming back to individuality, you want to get a full health history, both from a biomedical side and from the East Asian medicine side. So we spend a lot of time looking at also menstrual cycles. What's your menstrual cycle like? How long is it? When did you get it? What is the color of your blood? We go into great detail about, what does your cervical fluid look like? That kind of stuff, because it's been categorized within that explanatory model of patterns in Chinese medicine. So when we are putting together a treatment plan, we use all that information along with where are you in your cycle? What are you doing with a fertility doctor, if at all? And if we see things that say, hey, maybe you should go see a fertility doctor, I'm going to send you to one and we can all work together. We can come up with a treatment plan that could include acupuncture. It could include some of those other modalities I was telling you before, like lifestyle modifications, nutrition. Maybe it'll include herbs if it's an appropriate case. Maybe it'll include some nutritional supplements if that's also appropriate. But it could also include Tai Chi or maybe even Qigong. We have a really deep toolbox from which to pull from that also really is about what a patient wants.
How does acupuncture help fertility?
Well, I think there's a lot of ways we could think about it, but there's like 5 primary ones that are really demonstrable and have been measured in research. And I really think of blood flow, I think of neurotransmitters, I think of endorphins, blood glucose, and insulin sensitivity. So all of these are influential in one's fertile potential. So if you don't mind, I'd go into each of these pretty quickly. Like acupuncture, a lot of us have a really strong reaction to the world that we live in today with very good reason. There's a lot going on. We've just been through 3 years of a global pandemic and are still in it. But a lot of us are having to deal with an upregulated sort of nervous system, like the fight or flight response is very up for us. So acupuncture can help calm the fight or flight response, and that's your central sympathetic nervous system. And by down regulating this, we're helping to make those little blood vessels open up a little bit so we're not so tight and aggravated, like getting ready to run away, that we actually can stop and be relaxed. And it helps to bring the blood flow to the areas that it needs. So in reproductive medicine or fertility, we're thinking about ovaries and uterus and sperm for our testicles for sperm. If you have a shoulder problem, we'll send the blood to that so that your shoulder can get repaired. Well, when I think about neurotransmitters, we see that they will have more of an increase of release within the body, and that's helping to establish that conversation between the brain, the pituitary gland, and then the sex glands like your ovaries and your testicles, so that you make more sperm if you have testicles, or your follicles develop appropriately, you ovulate on time, you have regular cycles, and ultimately, we hope by having regular cycles that increases your fertility.
I don't want everyone to think that they have to do acupuncture. Can we talk about that for a second? Because then I also feel that sometimes patients feel ashamed if they're not doing absolutely everything possible and if it could at all help, but yet they're afraid of needles or they don't have a good experience with their acupuncturist. Like, do you think everyone who is going through fertility treatment or suffering from infertility, do you think everyone needs to do an Eastern approach to care?
I don't think we should ever say everyone should do something, right? But to your point, do you have to do it? I really don't encourage folks to force themselves to do anything that viscerally or emotionally feels like it's not right. I've had patients where I have actually, I'll see them for a few weeks and I'm noticing that they are, eyes wide awake when you first walk back in the room after the treatment, and they don't feel like they're very clear about, I don't really feel anything. And I'll sometimes ask, like, what do you notice in your body after we have put the needles in, you've laid down for a little bit, I might play some music, I might put some warmth on them somehow, either through a light or through another way. Maybe I'll do moxibustion on them. If I notice that they are not relaxing, I will ask them, how do you feel? What do you notice in your body at this time? And if they're in a state where they're just like, I don't really feel anything, or they're very fidgety, or like it feels like, and I'm a pretty gentle needler, I will be very clear with you, Lora. When I first started getting acupuncture, I hated it.
Oh my gosh.
I did. It was really painful. I didn't understand that it didn't have to be painful when I was getting it before. And then when I started getting it, then it wasn't painful. I was like, oh, that's what this is. Okay.
I actually really appreciate your sharing that because I've never had pain with my
Mm-hmm.
experiences, but that would be really traumatic for someone that's like, oh, I'm trying to help my fertility. I'm going to do acupuncture. And maybe
Mm-hmm.
people don't realize that it doesn't have to be painful. So thank you for sharing
Right.
that.
It does not have to be painful. In fact, one of the teachers that I have followed for many years, he's passed away now. His name is Wang Juyin. He was in Beijing. His main thing he would say was the key to this is that they should not feel the needle going in. They should feel a little something after. And that little something that you feel should be like a little bit of achiness, maybe a little bit of heaviness. Maybe you feel a little tingling, but nothing that's needly, nothing that's fiery or burning or anything like that. And I always like consult with my patients and say to them, hey, if you notice something like that, I need you to tell me. You don't have to endure anything here. I did have the incredible honor of working at UCSF in the cancer center and with patients who had tumors and pain. And I participated in a study, and I don't know if it's been published yet. I was so honored to be a participant in that because it reminded me of how powerful acupuncture can be, even when someone is under immense duress from just being under a lot of pain and already taking a lot of medications and hadn't rested in several days, and just putting in a few needles and they immediately fell asleep. Like, that was incredible to see. It reinvigorated my commitment to, like, oh yeah, there's a there. Like, this is
Mm-hmm.
not magic, quote unquote. Although sometimes people feel that way, and I totally get that. It's weird how this works because we don't really know exactly how it works.
What is moxibustion and how would that be used in fertility?
So moxibustion is the dried herb of a plant. It's this big bush of these incredible soft leaves called mugwort. And of the Chinese mugwort, they dry the herb and then they can compress it or powder it up into either to a loose powder, or you can charcoalize it and make it into a stick. So we burn that either above an acupuncture point, or you put down some kind of protectant to the skin and you can burn it directly on the skin so you don't actually harm someone, but you warm them. One of my favorite ways to do moxa is to put a little bit of salt on someone's belly button and then make a couple of cones of moxa on my own and then burn that over the salt. And it's so delightful, Laura. It feels so good, especially if you have tummy issues, belly issues, and you're cold.
Tell me about cupping. I remember seeing Michael Phelps at the Olympics with all the circles on
Mm-hmm.
his body and muscles. What is cupping and how would you use cupping for fertility?
Cupping's really great because it helps to sort of show your body that it can stretch in a different way. So it pulls your muscles out as opposed to pushing them in, like if you're doing massage. It's they use it in lots of different types of medicine. Physical therapy uses it. They call it like myofascial decompression. So how would we use cupping in fertility? I would say that it's not a primary modality that we would use, but if you have a lot of low back pain, especially prior to your period, which many of us have, thanks, PMS, that's a great time to use it. When you're pregnant and you're further along in your pregnancy and you're starting to get a little bit uncomfortable, it's very effective then to help support pain management because you can't take a lot of medications then.
How about herbs? That's recommended quite often in traditional Chinese
Mm-hmm.
medicine. How in the world can you learn all those different herbs and know exactly what would be right for different people and different situations? Just incredible.
Chinese herbs are largely like they were really born out of observing people taking certain foods, certain leaves, certain plants, certain roots, and how did they impact the body. And so if we were going to use them in reproductive medicine or fertility specifically, we're going to choose specific herbs that are tailored to the needs of a particular patient. So let's say you have endometriosis and you have endometriosis that's really, really painful. You might have a lot of lesions in your abdomen that they found on the imaging, and you are dealing with a lot of pain. And so we would use a specific formula with herbs that are all about dealing with pain. But there might be other people who have endometriosis that's not painful,
Mm-hmm.
but it's still impacting them. So we wouldn't be worrying so much about pain management, but invigorating blood so that you have a lining that can allow for implantation and for a sustainable pregnancy.
So what things have you actually seen traditional Chinese medicine help? Like if you had a friend, you had a patient who was having, like you've mentioned, painful periods, you've mentioned follicular development, you've mentioned PCOS. Is there things that you've really seen this type of treatment really help? It sounds like a little bit of everything.
Well, yes. I mean, you can't be in reproductive medicine, specialize in it, and not see everything because so typically we are the last person on the medical field that someone will come and see if they're dealing with infertility. So I often see folks who have been through lots of cycles or have been trying for a really long time. And I have seen anecdotally over and over again, patients do somehow improve and they do somehow get pregnant. They have babies, they stay healthy, they deliver the baby, and they're healthy at the end of it. And I think we're all interested in that as an outcome.
It's interesting. One thing that you said is that you feel that oftentimes the traditional Chinese medicine practitioner is the last one on the team for a fertility patient. I see it in multiple different ways. I have acupuncturists that have been working with patients for a long time, and they're like, you know what? I've kind of reached my limit of what I can do to help. I really want you to go see Dr. Shahine because there can be a role for Western medicine into fertility care. And then there are times where I see patients that might have diminished ovarian reserve or failed multiple attempts at finding good embryos. And sometimes I'm like, okay, let's just try and get somebody else on the team, including your therapist, to think through stress management tools. Let's get an acupuncturist on board just to support you. And I don't know whether it's sort of taking a little bit of a mental break at some point, focusing on lifestyle modification, but I have seen people come back and have better outcomes after working really closely with a fertility acupuncturist. So how would somebody find an acupuncturist that focus on fertility? I think it's really important for people to find an acupuncturist that really focuses on fertility, but how do you tell people to find those traditional Chinese medicine providers?
Yeah, to look for a licensed acupuncturist that's board certified, but then to also look for someone who has done the work. They have done some extra study to better understand reproductive medicine, understand fertility. They can be board certified through the American Board of, I guess it's now called the Acupuncture and Traditional Chinese Medicine Board of Reproductive Medicine. So that's aborm.org. You can go to that website and search for fertility acupuncturists who have a demonstrated minimum competency in reproductive medicine. The other thing is like ask your doctor. Often, like you know who people in the community that you would refer to, and you will give names specifically. And then finally, you could always just email me. I know a lot of people, gratefully. Some are on the ABORM list, some are not, and we're all over the United States. If you can't find someone, and then you can always email me. Then there's also you could do telehealth with someone and do treatments on yourself at home that don't require you to needle yourself. I could show you how to apply transcutaneous electroacupuncture stimulation. And this is basically like TENS machines that you would normally use for your back pain, but we can put them on acupuncture points, adjust the settings a little bit, and use them to help support blood flow to the ovaries, to help regulate your hormones, to help reduces stress. It's actually been great for IVF related anxiety. It's been great for sperm quality. So motility and count have improved with this particular intervention. It's easy, it's painless. It's really the cat's meow if we are not wanting to do needles.
That's incredible. I love that idea. That makes it so much more accessible to people.
Yes.
If it doesn't have to be in the office. One thing that I very much appreciate you is your ability and training and expertise in applying clinical research to try to study traditional Chinese medicine. So, what does the research show? I have seen research that shows that acupuncture can increase blood flow to the uterus and help with thin endometrial lining, help increase blood flow to the ovaries, and sometimes it helps with follicle production, sometimes it doesn't. What have you seen, and what studies are you involved in, and what have you learned?
We've learned so much in the last few years. I mean, this started like the first study was from 1996, and I can't even believe that that's true. And since then, there's been tons of studies that have occurred, but I think it's not a slam dunk when we're looking at the research, which is so frustrating because anecdotally, like I'm in my clinic, I see people improve. We could spend a whole hour just going into all of the nuances of why it's hard to study acupuncture. So, what we've seen in small studies, so let's just go with this. So, acupuncture has helped people have more regular cycles, it's helped them ovulate more regularly, it's helped them have a reduction in androgens. So, like for folks with polycystic ovarian syndrome, they get more androgens circulating in the system. We have seen a reduction with acupuncture, and this is a lot of acupuncture. So, it's twice a week for like 16 weeks. So, it's like 32 sessions. That's a lot. We've also seen, as I said earlier, changes in insulin resistance with acupuncture. So, when I think about IVF, there's my own research, what I have worked on recently. I just did a paper a couple months ago where we looked at acupuncture for IVF related anxiety, and we saw significant reduction in IVF related anxiety when we look at acupuncture to help IVF and the purpose of like birth outcomes. The data is really mixed. Like some studies say, yes, it helps. And then other studies say, no, it doesn't. And what we found is that 9 to 12 sessions of acupuncture, so more acupuncture, has been associated with better outcomes. More people getting pregnant and delivering babies, fewer miscarriages, fewer ectopic pregnancies. That's all been seen in this observational research. But that's not a slam dunk. And in my own personal study that I did at Seattle IVF Center, oh my gosh, how many years ago? So many years ago, it doesn't matter, but it was more than 1,000 patients in that particular cohort. And we saw a twofold increase in the odds of having a take-home baby when they added whole systems traditional Chinese medicine to their IVF cycle. And they had a 75% reduction in biochemical pregnancy. So that's like the pregnancy that isn't, it's a positive pregnancy, but it's not a viable pregnancy.
I've also seen patients that are honestly nervous to share with their doctor that they're doing acupuncture. Like they have actually been shamed by their Western medicine doctor and like honestly sometimes withhold herbs that they're taking or,
Right.
the fact that they're doing acupuncture. And that is not the right approach. Like I want to know what you're taking and what you're putting in your body because guess what? Ginseng and fish oil and things act like aspirin and it can increase risk of bleeding at your egg retrieval. So I just really hope that people can have an open conversation and that if they really are getting shamed, it's good to counsel and it's good to, follow your doctor's orders. But if you're getting shamed for pursuing alternative care, maybe it's time to look for a different provider.
I kind of see us less of an alternative and more as a complement.
Oh, I love it.
and and that we can work together, and that when I'm working with patients, and I know this is also true with other acupuncturists, and what I also train when I'm doing my own continuing education for acupuncturists to become fertility acupuncturists, is to collaborate. Let's tell the doctor we saw a mutual patient. Let's tell them that this is our treatment plan. Let's tell them, hey, we're thinking about Chinese herbs. Do you have any concerns? Maybe we can discuss this if you have them. In the big picture, I think it's best and safest that we all get on the same page. Like we can all kind of work together and with the patient in mind. Like, what does the patient want? Like, being patient centered is key.
Can acupuncture or herbs actually harm fertility? Like any side effects we should be aware of?
So, when acupuncture is provided by a licensed acupuncturist, these are folks who are that again board certified, who are proficient in fertility. Maybe they also have ABORM certification. Acupuncture has been found to be very safe. What we don't see in the data is an increase also in the rate of miscarriage ectopic pregnancies or chemical pregnancies with acupuncture. So it's actually a really safe intervention. With herbs, we don't have as much data, so that is a limitation right now. If I'm working with a patient who I don't know how they're going to respond to any kind of other therapy, or I'm unclear about actually what's going on the Western side, I really want to see their records if possible, if they'll release them to me. That way I know exactly what medications they're on. I'll know exactly what prescriptions have been given and what other conditions could be in the health history that maybe they didn't remember to tell me. And that's very common. I want to just be as safe as possible. So then we can add herbs in a way if it's necessary and it's appropriate to be the most successful.
If somebody wants to add acupuncture or traditional Chinese medicine to their IVF cycle, when should they see that provider? When should they make that consult?
Ideally, we'd love to see someone 3 months before they do their embryo transfer or their egg retrieval. Now, we know that that's not always going to be the case, but the moment that you start with your fertility doctor, maybe also call your acupuncturist. If you aren't already associated with one, ask your doctor for a referral.
But you're talking to the IVF doctor that knows that age is just not your friend when it comes to fertility. So I am balancing it with my patients. I'm like, yes, I want your health to be optimized. I want everyone on your team. But if you're 42, I think 3 months is a really long time to wait to do your egg retrieval.
I think we have to do what we can. And I really want to meet patients where they are. And I love that you just said that, Laura, because time is not on our side. But I also don't think someone should avoid doing something because they can't give it 3 months. And I also don't think we should stop someone from moving forward because we have to do 3 months.
Right. And I also don't think it has to be mutually exclusive. I think you can move forward with your Western doctor if you're planning to do IVF. And like you said, work with your Eastern provider because you never know what's going to happen. You could want to do an egg retrieval next month and the stars are just not going to align. And it's actually going to be 2 or 3 months from then. So it can all work together. Does everyone who's planning on getting pregnant or having trouble getting pregnant need to do traditional Chinese medicine?
No, they don't have to. But I would say that they would benefit by addressing multiple aspects of their whole self. They'd be helping your digestion, helping your sleep, helping your nutrition, helping all of the different ways that we are healthy individuals. So that hopefully when you become pregnant, you stay pregnant, you have a healthy pregnancy, you deliver a healthy baby, and you're healthy at the end of it.
Absolutely. I appreciate you so much, Lee. So if we want to keep learning from you, where can we find you?
So I am at rosefinchhealth.com. I'm in Portland, Oregon now. And if you need, if you're an acupuncturist and you want continuing education, that's at rosefinchacademy.com. And I'm also on Instagram at rosefinchhealth.
Thank you for being here today. I hope you enjoyed that conversation with Dr. Hullender Rubin as much as I did. I have always learned from her and appreciate her clinical research approach to Eastern medicine because I've just seen such benefits in my own patients. I was so surprised and really excited to learn about the benefits of non-needle acupuncture and even the ability to do it with telemedicine and finding a benefit. I think that's going to open up acupuncture to people that might be afraid of needles and have difficulty in access to care, getting to acupuncturist appointments. That was an incredible takeaway. I don't think everyone has to have an Eastern approach to their fertility care, but if they are interested, it can absolutely be additive and it can be something to explore. So thanks for being here today. I'm your host, Dr. Lora Shahine, and this is Baby or Bust. If you like this episode, let us know. Give us a 5-star review and follow the show wherever you listen to your podcasts. Baby or Bust is produced by Mark Ramsey, Jamie Solis, and Greg Moga. Executive produced by Paul Anderson for Workhouse Media. Baby or Bust is a Mark Ramsey media production.